Hi, my name is Morgan Simmons, and I'm a PN student at Wilson State College. Today I'll be performing how to administer oral, ocular, and transdermal medication. Now, before I can even enter the patient's room, I'll need to take a look at my orders. So I'm going to perform hand hygiene. And then I'm going to look at my orders. So my patient today came in for pneumonia and secondary diagnosis of congestive heart failure. She is a 33-year-old patient, Shirley Koss. Date of birth is April 3rd of 1987. And she is going to be administered Refresh Plus lubricant eye drops, 1 drop per eye 3 times a day. Fentanyl 50 microgram per hour transdermal patch twice a day, augmented 600 milligram by mouth twice a day for 7 days, and then ibuprofen 800 milligrams by mouth every 8 hours as needed, so I'll have to assess that in the room, and then digoxin 250 micrograms by mouth daily. So I'm just looking at this, and then once I looked at that, if I had any questions, I would contact the provider, or any questions about the medication, I'd be sure to look up before entering the room. So I'm going to enter the room. Hi, Ms. Koss. My name's Morgan. I'm going to be your student nurse for the day. Hi, nice to meet you. Okay, I'm just going to verify your name and date of birth on my MAR. Okay, perfect. So, Shirley Koss. And then what's your date of birth? Okay, April 3rd. Okay, 1987. Perfect. Thank you. And then you have 2 allergies. Okay, promethazine and codeine. Okay, perfect. Thank you. So how are you doing today? You're in a bit of pain? Can you tell me where that is? Your lower back? Ooh, okay. And is that pain shooting, stabbing? How do you feel? Okay, it's shooting. Okay. How long has that been going on for? About 2 days. Okay, and how long does that usually go on for? A couple hours? Does it get worse when you sit or get better? It gets worse. And movement? Okay, movement and sitting make it worse. Okay, and then what relieves it? A hot pack and laying down, okay, when you're resting? Okay, and then Shirley, on a scale of 0 to 10, 0 being the worst, 10 being 0 being no pain at all, 10 being the worst pain in your life, how would you rate your pain today? Okay, a 7. Okay, quite a bit of discomfort then, I see. Okay, so before I go and get your medication, Shirley, I'd assess your vitals and make sure those are all good. And then I'm also going to assess your lung sounds and your apical heart rate or pulse rate, because for your digoxin it needs to be greater than 60. Okay, so I'm going to do your lungs first. And I'm going to listen. Okay, I just hear a bit of crackling, but since you have pneumonia, it's okay. And then I'm just going to be taking your apical pulse, okay, Shirley? So I'm going to be going the 5th intercostal and the mid-clavicular line. And then I'm going to take that for 1 minute. So I've taken that for 1 minute, and your pulse is 73. So your pulse is good enough to administer your digoxin. And then Shirley, are you able to swallow? Okay, you are? Perfect. And then do you want some water with your medication? Okay, good. Can I get you anything? No? Okay, well, while I'm here, I'm just going to check for edema on your legs, just to make sure. Okay, perfect. So it looks like nothing, so we're good. And then I'm just going to leave your call light right here, okay? Okay, and then you let me know if you need anything, but I'll be going to get your meds, okay? Perfect, thank you. And then I'm out of the patient's room, so now I can set this aside and start with my checks. So now that I'm on here, I'm gonna be looking on here and be doing my first check. So my first check, I've just been looking at my medication, and I'm in the bedroom. So I'm gonna start off refresh lubricant eye drops, okay? Yep, 1 drop per eye 3 times a day. Okay, perfect. So that's that. The expiration date is good. It is currently 9:05, so I'm within 30 minutes, so I'm good. And then expiration date's good. Perfect. So, and then I'll move on to my fentanyl patch. And then it's 50 micrograms per hour transdermal patch twice a day. Okay, 9 a.m. surely cost. There's no rips or tears. Okay, and then I'll move on to my Augmentin. Okay, 600 milligrams by mouth twice a day for 7 days. First dose starting yesterday. Okay, perfect. The expiration date. And then I did dimensional analysis, so that's 7.5 milligrams. So that's good. There's everything looks good. Bottle isn't damaged or anything. And then I'll be moving to my ibuprofen. And I also did dimensional analysis, so I'll be giving 2 tablets because it's 800 milligrams by mouth every 8 hours and PRN for pain. So Shirley expressed some pain, so she will be administered that. And then the digoxin right here. So I've done my dimensional analysis again, and so that is this is 0.25 milligrams, but this is 250 micrograms, so that's the same thing. So this is 1 tablet. And then I've confirmed that all this, the expiration date isn't out of use and no rips or tears, and if that's going to be given orally. So once I've done that, and I've looked over it, everything is in the correct time, correct patient, surely I'm good to move on to my second check. So I'll place this out, and then I will be grabbing my fentanyl patch. Okay, so 50 micrograms per hour transdermal patch twice a day at 9 a.m. for Shirley Cost. Okay, perfect. I'm going to set that there. And then I'm going to be grabbing my digoxin. Okay, my digoxin. Okay, 250 micrograms, which is 1 tablet by mouth daily at 9 a.m. for Shirley, and her heart rate was good enough, so there we go. And then I'm going to be now pouring my Augmentin because I can't take this bottle into the room. So I'm going to pour it here. So I'm going to make sure to hold it like this so I don't damage the label. And then if it wasn't all throughout the bottle, I'd give it a good shake, but it's already there. So I'm going to be pouring this, and then I'm going to be going down to eye level and make sure the meniscus is right at the top. So, okay, I've got 7.5. Once I poured that, then I look at here and then check the expiration date again. Everything is correct. 9 a.m. Shirley Cost. Okay. And then now I can do my Refresh Plus lubricant eye drops. So do 1 in both eyes 3 times a day, 9 a.m. Perfect. And then lastly I'm gonna do my ibuprofen. Now the last given, it says every 8 hours, and I'm still okay to give it because the last time was this morning at 500. So I'll be getting 2 tablets. So I've got my 2 tablets of ibuprofen, and I'll just be placing them in there. And then I'll put on this, and then I'll be grabbing my other one. Perfect. So since I have everything, now I'll be looking at this, just making sure it's correct. Okay, now that I have my bottles in here that I need to keep in my med closet, I'll just be keeping them in there. And then now I'm able to go into the patient's room. So, hi Shirley, how are you doing? You're still in a bit of pain? Okay, I see. Are you still feeling able to swallow for me? Okay, sounds good. So before I administer, I'm just gonna take your apical heart rate again, okay? Okay, sounds good. And then I'll be scanning your bracelet in just a little bit, okay? Okay. Okay, so your heart rate is 75. So I would have taken that for a full minute. And I've got that. Are you still doing okay? Good. Okay, perfect. So I'm just going to be scanning your wristband, and I've made sure none of your allergies conflict with your medication. Just going to scan your wristband. Now I'll be putting on gloves. Gloves want to get on. Okay, so I'll be putting on gloves. Okay, Shirley. So I got you a cup of water, okay? This is just for you to swallow down with your medication, okay? Perfect. So we just checked your apical heart rate. So we'll do your digoxin because I'm gonna do my third check. Okay, perfect. So digoxin 0.25 milligrams. And then this is 250 micrograms, same thing. So I'll be getting my second cup. There we go. Okay, perfect. Here you go. Thank you. Here's some water. I'll just be throwing this away. Okay, so now I'll wait for my fentanyl patch. Okay, now these are just your ibuprofen. So 800 milligrams by mouth every 8 hours. PRN is pain. You still express pain, correct, Shirley? Perfect. So here you go. Thank you. Just going to be throwing these away. Okay. And then that digoxin was for your congestive heart failure, and your ibuprofen was for your pain. And then this augmentin is for your pneumonia, okay? So here you can take that. Perfect. Okay, next, Shirley, I'm just going to be moving you down. So we can put in your eye drops. Okay, Shirley. So I'm just going to be wiping your eyes just to make sure there's nothing in the way. Okay, perfect. Is that good? Do you feel all right? Okay, sounds good. So then I've got your refresh eye drops by mouth 3 times a day, eyes, 1 drop per eye 3 times a day. Okay, perfect. So I'm just going to be gently pulling down in the middle and 1 drop. There we go. Thank you. Okay, Shirley, and then your fentanyl patch, 50 micrograms per hour, twice a day. So it says your last one was on your right upper back, so we'll be taking that off and placing a new one. Okay, so this is correct. So I'm going to be taking off your new one, or your old one, sorry, excuse me. And then we'll take this off, making sure not to get it, and then wiping, and then throw this in the trash, and then this goes in the sharps container, just so that no one can grab it or anything from the garbage. Once I have that, then I'll be able to open my new patch, and it's not expired, it's still 9 It is currently 9:08, so we are still good. I'm gonna open up my patch. Okay, and then I'm gonna grab my tape. And then I'll be dating it. I'll be putting my initials, the date, and then the time. So 9:08. Perfect. And then Shirley will be putting this in a new location. So I'm just gonna put it here. I'm gonna grab a wipe right before. And we're just gonna wipe so then no oils or anything are in the way and this can get absorbed. Okay, perfect, Shirley. Thank you. Now, Shirley, I'm gonna move you up so you're just a bit more comfortable. And then I would change my gloves to make sure I don't get any of the fentanyl anywhere. And then I'll make sure Shirley's doing okay. I'll put her call light by her, make sure she doesn't need anything. If she needs a snack, I will get her one. Are you doing okay? Okay, perfect. And then I'll come back in 30 minutes to reassess her pain with her oral medications. And then I'd clean out my area. I'd make sure everything was documented. And I would make sure that Shirley is comfortable. She has privacy. I'd leave the door open or shut and how she'd like it. And then I'd document. Thank you.